Hi, I'm Marvin Plackett, and today is Tuesday, August 4th. Every once in a while, I just want to remind you how I look when I am walking around anywhere outside of my office. We'll change this right now. I walk the talk. It's very important that we all do that. Okay, so here we are once again. Nothing has changed since yesterday. We have 6 active cases of COVID-19 at Episcopal homes. 1 is a resident back home at King's Crossing, and 5 are staff. And so let's hope that we see recovery soon on their behalf. Later this week, once again, we will continue our testing at the gardens, floor 4, and hope that all goes well there. Remember how vigilant that we must be, because that's what keeps one another safe, is the social distancing, staying at least 3 arm lengths apart, wearing our face masks at all times, and remembering frequent hand washing, and of course if we have any symptoms that we immediately self-isolate and get checked. Today in the Star Tribune, there is one of the front page articles, Minnesota plans for COVID-19 vaccine distribution. State is one of 4 taking part in CDC pilot program. Seems early to be talking prioritization of vaccinations, but maybe not. I mean, it's good that this dialogue is starting. Of course, none of us knows for sure when there is going to be a vaccine or multiple vaccines, but they are talking about how it would be prioritized. So I'm just going to jump in and read a few of the excerpts in the middle of the article here. When it comes to a vaccine, healthcare workers will likely be first in line given the risks of infection they face in working with COVID-19 patients. Healthcare workers have to be at the top of the list, said Michael Osterholm, director of the university's Center for Infectious Disease Research and Policy. We need them so badly. Who next? The elderly population would be one choice. People 70 and older make up only 9% of known infections in Minnesota, but 80% of COVID-19 deaths. Priority also could go to residents of long-term care, who have suffered 76% of the state's COVID-19 deaths, or to pregnant women at greater risk of complications. So as you can see, Episcopal homes and similar organizations like ours will likely receive very high priority when it comes to the availability and prioritization of vaccines. Consideration also needs to go to minorities who have higher levels of skepticism over vaccines in general, but also worse COVID-19 outcomes, Ostrom said. In Minnesota, Black people make up 21% of known infections, but less than 10% of the state's population. Minnesota was selected as one of 4 states providing planning advice to the CDC via a new pilot program because of its history of working with medical providers to create ethical treatment guidelines, Malcolm said. This is something Minnesota has really been leading the nation on for probably 20 years now. Not all COVID-19 vaccines will end up being the same, and that could further complicate prioritization plans if studies show that some versions work better in certain demographic groups. And then ending the article here, different vaccine approaches augment different elements of the immune system. Bradley said, whoever Bradley is. Anyway, like I said, I'm just jumping around in the article. As of today, we don't know which ones of those are preferable. Until we have that knowledge, it makes sense to develop a variety of different approaches. So anyway, but certainly good to see here that in these early stages of dialogue about prioritization that Episcopal homes and similar organizations, healthcare workers and the elderly, that will be prioritized towards the top. So that's very good to see. I had a nice conversation with Kristen Aitchison today about helping me to generate more and more interest from you to participate in this 1:30 live stream update. I mentioned, of course, Henry West joined me a couple of months ago. That was just terrific. And I've read poetry from some of you, and I encouraged you yesterday and multiple times. I'm encouraging you again, and we're going to rope you in to figure out how you'd like to join me and participate in this live stream update. Fully living, right? Helping everyone in our organization here at Episcopal Homes to be in this together and to share joy and to share creativity and to share inspiration. So I need you, all right? So don't hesitate to send me an email, give me a call. My email address is mplackett@episcopalhomes.org. And with any of your poetry or anything that you'd like to do. And like I said, Kristen Aitchison is another one that's collaborating with me to make this happen, all right? Okay, so I look forward to seeing you tomorrow at 1:30. And now for some closing words from Phil Rose.
Thank you very much, Marvin. So in seminary, we study the anthropology of, what did they call it? I can't believe I'm blanking on this term, theological anthropology. So it is, do you believe that humanity is essentially created good and gets itself into trouble, or that humanity is essentially created evil? And there are kind of two schools of thought on this. There is Augustine, who is he promoted the idea of original sin, and so many things have been built around that idea that there's original sin. And it leads to things like the book, The Lord of the Flies. The other side are folks that would argue that instead of original sin, we have original blessing, and that this would be St. Francis of Assisi, some of the mystics, and a modern theologian by the name of Matthew Fox. Matthew Fox wrote quite a bit about original blessing. And recently, there is a book that is just out. It actually came out in May, and it's by a man named Rutger Bregman. Rutger Bregman is a scientist. He's a social scientist, and he studies humanity and how we treat one another. And the good news from him is that all of the studies that he has done and that sociology and anthropology have done is that the radical idea is that deep down, most people are pretty good. Most people are pretty decent. And that is an important thing for us to keep in mind as we come to grips with a pandemic and the racial injustice that we're dealing with, that at the end of the day, most people are pretty good and they want to do the right thing. And he came up with 10 strategies, the 10 things to keep in mind. And today I'm just going to list them. In the future, I might go more into depth about them. Number 1, when in doubt, assume the best of others. 2, think in win-win scenarios. Number 3, ask more questions. Number 4, temper your empathy and train your compassion. That one intrigues me. I don't know what he means by temper your empathy. I'm going to have to find out. Try to understand the other, even if you don't get where they're coming from. Number 6, love your own as others love their own. Number 7, avoid the news. I've heard him talk about this, and he says there's a great place for journalism, there's a great place for staying informed, but avoid the constant 24/7 news, the breaking news. That will just leave you depressed and anxious. Number 8, don't punch Nazis. That one I definitely want to find out more about. And then 9 is come out of the closet. Don't be ashamed to be good. And number 10 is be realistic. His book is really kind of a hot topic right now, and I recommend that you look him up. It's Rutger, R-U-T-G-E-R, Bregman, B-R-E-G-M-A-N. And the name of the book is Humankind. Where's the exact title? Humankind, A Hopeful History. So I hope that he is right. There's some great interviews out there on the internet with interviews about his book. And I love the expression humankind, be both. So that's my message today. Humankind, be both. Until we see each other again, be well.